Hi my beauties. Okay, today I'm going to be talking about lower face rejuvenation. So this is a topic that you guys have asked me to talk about, not only in clinic with the hundreds of people that I see every week in my dermatology clinic, but just on DMs and comments. And I know that a lot of people are hesitant to have surgery or never want to have surgery, and I totally get that, and I vibe with you guys on that. It's very important to know what non-surgical options we have for lower face rejuvenation to keep this area nice and tight, and also to prevent the need for surgery in the future. So I apologize ahead of time if you hear my kids running around and you hear little voices in the background. I'm just at home on a Sunday afternoon with my family because usually during the week I'm in the office doing procedures and seeing patients. I don't have time to film YouTube videos, but I do want to make it a point to get a video out every weekend to you guys on a topic that you want to hear about. So today it will be lower face rejuvenation. And every week I'll post a dermatological educational video on different topics that you guys want to hear about. So be sure to subscribe to my channel, hit the bell so you get notifications as soon as I post a video. I'll try to get a video out at least once a week to you guys on a topic in dermatology or skincare or medicine that you guys want to hear about, that you've been asking about. Share this channel or video with other friends or family members who would find it useful and who love skincare as much as we do. So hopefully this video will be useful to you. And again, just leave me a comment. I'm sure I'll get to it as soon as I can to engage with you guys and answer your insightful questions and be responsive to your comments as well. So when talking about lower face rejuvenation and non-surgical methods to help improve this area, it's important to understand what happens with the aging process. So we all know that as we gain wisdom and have birthdays and get older, we lose collagen and elastin in our skin. So we lose that tightness to our skin. Our skin becomes laxed, it becomes loose, it becomes wrinkled, and that's because we lose the collagen and elastin. But another phenomenon that happens as we age is we get bone resorption and the dermis gets thinner. So even below the skin, you have decreasing structural support underneath the skin that used to hold it back up. So at age 50 and beyond, as sad as this is, it's the truth, and this is what happens, but we get bone resorption. If you look at the skull or the mandible of a person in their 30s, 40s, 50s, 60s, 70s, and beyond, the jawbone gets resorbed and basically disintegrates over time. So you don't have that structural support holding that skin back that you once have. I always tell patients it's like having a tablecloth with a table underneath it. As the table gets thinner and doesn't have that structural support, the tablecloth starts to sag and fall and become laxed over time because it doesn't have that dense structure underneath holding it and propping it up like it used to. So that's where dermal fillers come into play. And there's lots of different dermal fillers out there. So there's hyaluronic acid fillers, there's stimulant fillers, and knowing which filler performs best in which area of the face is really important for an injector and for a provider to be able to provide for his or her patients, because different fillers have variations in thickness, which we call the G prime. How thick is it? How robust is it? How thin is it? So in areas like the jawbone, when you're trying to reestablish that structural support after bone loss has happened and made the skin saggy, you need a high G prime or a thicker hyaluronic acid based filler like Voluma, for instance, that's going to provide that periosteal support. That's in contrary to, for example, the marionette lines. These marionette lines and these nasolabial folds that form over time, you need a mid thickness, a middle of the road G prime like a velour or like a Juvederm to be able to correct those folds. So the type of filler and where you're injecting the filler and the dermal plane and what you're trying to correct really determines the type of filler that is needed to correct that area. And a little goes a long way. If you're a patient of mine, you know I'm very conservative. Most of my patients look 15 to 10 years younger than they are, but like nothing has been done, because it's baby steps, baby little tweaks along the way. You don't do too much too fast, because that's when people start looking weird or overdone or not like themselves. So as we talked about, a higher G prime, thicker filler would be here along the mandible, which would be different than a mid-strength G prime like a velour that would go here or here. And then when you talk about things like very superficial lines, like the little creases that happen here in the smile lines or the lip line creases that can occur around the lips, you'd want a very lighter, thinner, a lower G prime like a Volbella or an RHA2 or hyaluronic acid based filler that could be injected in a very superficial dermal plane to help kind of smooth out those little fine lines and wrinkles on a very superficial surface, which would be different than a thicker, more robust filler that needs to be here to kind of hoist up that skin. So that's where it comes into play, which filler goes where, knowing which fillers perform best in certain areas of the face, and the correction that we're trying to achieve determines the type of filler that we would use. In addition, we have stimulant fillers. So stimulant fillers include like Sculptra, which is polylactic acid, Radiesse, which is calcium hydroxyapatite. These basically stimulate your fibroblasts and stimulate your skin to make collagen and elastin and the glycoproteins and hyaluronic acid that gives skin its volume. So those are injected usually in other areas too, usually in the mid-face right here. Sculptra, Radiesse, they perform very well, and it enhances our body's own regenerative systems and processes to make that volume. So as we age and gain birthdays, we start to lose this mid-face volume. We also see it in younger patients who are very fit and very leaned out. As they have more muscle mass and they lose weight, they can become sickly looking or almost kind of gaunt in the mid-face right here. Sculptra is great for that, and usually it's about 1 to 2 treatments spaced about 1 month apart. Results last about 2 to 3 years, and it gives a very natural look because you're basically inducing your body's regenerative processes to correct that volume loss. So another non-surgical option that we have for lower face rejuvenation is tightening devices. So tightening devices use heat in the form of different energy forms. It could be radio frequency, it could be ultrasound, it could be microfocus ultrasound, it could be monopolar or bipolar radio frequency, it could be microwaves. There's lots of different ways to get energy into the skin. The skin responds to heat or energy by making collagen. That's why if you ever look at burn scars, under the microscope, they're packed full of collagen. Now, usually they're unsightly scars because there's these thick plaque-like looking keloidal type scars, but that's because the body responds to heat or injury by making collagen. So what these energy-based devices do, like Thermage, Ultherapy, Thermatite, it basically induces your fibroblasts on the deeper level to stimulate collagen and elastin. And that's what helps lift and tighten and pulls the skin. So doing Thermage like along the lower jawline will help lift and tighten and pull that skin from within by enhancement of your body's own regenerative processes to make collagen and elastin. It's usually pain-free when it's done correctly. Now, if you look online and you see different vlogs or different comments or different posts saying negative things about it, more often than not, that was not performed correctly by a provider who is well versed in how the biophysics of these lasers or energy devices work. Because when it's done correctly by a skilled provider, the results are next level, and you can't tell that anything was done. People just look really good for their age. So basically, what happens is the energy gets distributed into the heat in a very controlled, elegant manner, and it induces your body to make collagen and elastin, which helps lift and tighten and pull the skin. So this is great for lower face rejuvenation. It can even be used for a brow lift, a full face lift, or a neck lift without surgery. And usually it's one treatment, not multiple treatments are needed, just a one-time treatment. There's no downtime. And I have my patients drink their collagen peptides and live a healthy lifestyle and go on with their business. And basically the results start to show in a few months, and it keeps getting better over the course of a year. So on their 1-year birthday, they usually look 5 years younger than they were 1 year ago, which is really fun because we have our patients come in and take before and after pictures. And it's a really noticeable, beautiful change, but it looks very natural because you're inducing your body to do the work. You're not undergoing surgery. There's no scar tissue. There's no incisions. There's no downtime. You basically, after a Thermage treatment, can leave and go work out and go out to lunch with your girlfriends if you want. So no pain, no downtime, amazing results, and beautiful natural results. So on the topic of energy-based devices, there's many of them out there, and it's important to look at before and afters and true before and afters. And if you see negative things being said about one device versus another, look at who's stating those, and maybe it wasn't done properly, or maybe it was done by a non-surgeon or a non-MD or somebody who maybe isn't using the right settings or distributing the heat in the most efficacious manner. So just keep that in mind when you're reading pros and cons about different reviews about different products as well. It's always important to keep that in mind. There's also a lot of really new and exciting tightening devices coming down the pipeline. I actually participated in some of the clinical trials of these devices and know that they're going to be next level, but it's going to be a couple years before they're launched. But that's why I do YouTube. That's why I post on my Instagram. If you don't follow me on Instagram, be sure to follow me there as well, because I will keep you in the know in this rapidly advancing field in technology and aesthetics and laser medicine and energy-based device medicine, because there's a lot of new discoveries coming down the pipeline that are not yet launched. They're still undergoing FDA trials, but already in phase 2 trials are showing amazing responses and amazing before and afters. And I know that they're going to be a great success once they hit the market. So next I'm going to talk about lasers, because I know that you guys are probably wondering, how lasers help with lower face rejuvenation. As far as tightening and getting rid of the jowls, getting rid of the marionette lines, the skin laxity here, sharpening, defining the jawline, lasers actually help with skin resurfacing. So lasers help with stimulation of collagen, and it does tighten skin to a certain degree, but it's not as profound as an energy-based device. Lasers are very important though and have their role in skin aesthetics and skincare and rejuvenation and looking young and looking your best at every age. But the way that lasers work is by laser resurfacing the skin. So helping with those little fine lines and wrinkles, getting rid of brown spots, making skin not look so weather beaten, and making it look clean and fresh and rejuvenated with small pores and even pigmentation and even texture and tone. Lasers do have their role in aesthetics, but it's not so much for tightening. That's usually, or lower face rejuvenation for, marionette lines and jowls and things of that nature. That's more fillers and energy-based devices. So I hope that makes sense. Some patients can have a full-blown facelift and have surgery, but if they haven't been taking care of their skin or doing laser resurfacing, the quality and texture of their skin looks poor, and that can age them. So, I had patients that come in, they've never really done much to take care of their skin. They haven't been doing lasers, they haven't been photoprotecting, they haven't been using medical grade skincare, but they have a facelift, so they don't have any wrinkles, and they have fat grafting, so their volume looks good, but their texture of their skin looks poor. They have brown spots, they look weather beaten, and that's why most plastic surgeons, when they do a facelift, if their skin quality is not up to par, they'll do a peel at the same time as the patient's undergoing anesthesia, or they'll do a laser on top of the facelift, because there's nothing that looks worse than somebody who has a nip and tuck and they're pulled tight, but their skin looks old. So that's not the goal that we're going for either. So lasers do have their role, although not for this topic that we're talking about today, and I hope that makes sense. So the last but not least thing I want to talk about is Botox for lower face. So we know that Botox works for crow's feet, for forehead lines, for opening up the eyes, for brow lift, things of that nature. But what does it do for the lower face? Because I get a lot of confusion with patients coming in understanding master Botox for lower jawline Botox. So Botox along the jawline, which we call the Nefertiti lift, it works by basically inhibiting the muscles that pull downward and allow the muscles that pull upward to contract and go unopposed. So I do Nefertiti lift with Botox on myself along the jawline, and it just keeps this area nice and tight because there's a resting tone to the muscles that are always going to pull up because they're unopposed. Results usually last about 3 to 6 months, and it's usually 10 units along the jawline. That's different than master Botox. Master Botox is injected here. This is the large mastication muscle. It's called the masseter. So when you clench down and bite, you can feel this large muscle right here. It's a large muscle that's very strong, and you need at least 15 to 30 units per side to target that muscle. Usually that is injected for people with TMJ, teeth grinding, teeth clenching, or people who want to slim down the face. So that's different than jawline Botox. Jawline Botox is more for aesthetics to sharpen and define the jawline. Master Botox is to slim the face, or usually used for dental protection or for TMJ or for people that have a fuller face that want to contour out their cheeks a little bit more. So I hope this wraps it up for you guys. These are most of the non-surgical treatments for lower face rejuvenation. Just to recap, dermal fillers in different areas to provide that structural support to pull up, to fill in the folds or volume loss that are already apparent, which would be a different type of filler that's injected in the jawline. Stimulant fillers in the mid-face to lift up and to add that volume naturally. More superficial fillers that can help with the little smile lines or the periorbital lip lines, or what we call smokers lines, even though non-smokers get those lines from talking and eating and just your normal oral activity. There's tightening devices to tighten the skin on top. Usually you can reverse jowls and lower face sagging skin when you're more mature by doing the tightening devices, or actually being more preventative starting in your 20s and 30s if you want a collagen bank and restore up all your collagen, so as you lose it, you're keeping your place in time. It's always a great preventative measure to take, doing thermage or energy-based devices to kind of to tighten up this area and keep it smooth and tight with a lot of collagen stores, so as we lose 10% of our collagen each decade, that's the true meaning of anti-aging. You're staying in the same place. You don't look different, you're being proactive, and you're just kind of preserving your youth over time. Then we have things like thread lifts that are a little bit more invasive, but not as scary as they may look online. Then you have Botox, which usually lasts temporarily for 6 to 12 months. You could do it along the jawline in the masseter, and then also surgery. So when people need surgery, or they're beyond any level of non-surgical intervention, or any treatment that we can use to kind of get them the results or outcomes that they want, managing their expectations, then I refer to my plastic surgery colleagues, and then they can go to the OR. But when they come see me, it's usually for people who want to prevent surgery, don't want surgery at all, or just want to keep a healthy, beautiful lower face and jawline without the need for surgery. And I do think that the energy-based devices and non-surgical treatment options are the way of the future. For example, surgery at some point may be, some arcane procedure, like really you went into an OR and they cut and sutured your face to tighten it up, instead of just coming into a box and having some energy-based device just stimulate collagen and tighten your skin from within. That's probably the way of the future. And for right now, these are the best treatments that we have that are non-surgical. And hopefully this video made it make sense. Share this video with anyone who may find it useful. And thank you so much for following, and be sure to subscribe, because I'll get one of these videos out once a week for you guys. Hope you have a great day.